Bismillah ar-Rahman ar-Rahim. This is lecture 9 about the physiology of the excitable tissue. In the previous lecture, we talked about the autonomic nervous system. We talk about the anatomy of the autonomic nervous system, the arrangement of the sympathetic and parasympathetic, the different ganglia, the difference between the autonomic nervous system and the somatic nervous system. Today, we will talk about the function of the autonomic nervous system as well as the response of the body for stimulation or inhibition of this autonomic nervous system. Starting with sympathetic division of the autonomic nervous system. The effect of the sympathetic nervous system should be studied by generalized stimulation or generalized inhibition. We cannot study the sympathetic nervous system or study the function of the sympathetic stimulation on each organ separately. Why does this happen? Because as we said in the previous lecture, the anatomical arrangement of the sympathetic nervous system is through the autonomic ganglia. And most of the sympathetic ganglia are paravertebral from the thoracolumbar region, so that they have short preganglionic and long branched postganglionic nerve fiber. So, the stimulation of any segment of the spinal cord or any preganglionic nerve fiber in the sympathetic nervous system will produce a diffuse effect, spread effect on many organs at the same time. So that when we study the sympathetic response or the sympathetic function, we should do either generalized stimulation of the sympathetic nervous system or generalized inhibition of the sympathetic nervous system. Accordingly, if we do generalized stimulation of the sympathetic nervous system, this generalized stimulation of the sympathetic nervous system will produce a state that we call it fight or flight. Because generalized stimulation of the sympathetic nervous system will produce a state like an anxiety or fear. In anxiety, fear, or stress, we will either fight this stressful condition or run away from this stressful condition, or sometimes it might lead to freezing of the subject. He will not do any response. He just astonished from this stressful condition. All these happen by sympathetic stimulation. In generalized stimulation of the sympathetic nervous system, it will show itself on the body and in the internal organ. The signs and symptoms that appear on generalized stimulation of the sympathetic nervous system that we call it as external changes include, firstly, pallor of the skin, which means that there is pale skin, decreased blood flow to the skin, and this occurs due to vasoconstriction of the blood vessel. Why there is vasoconstriction of the blood vessel? Because the blood should be directed into the vital organ to fight this stressful condition. This is not always, because sometimes excessive stimulation of the sympathetic nervous system will produce release of adrenaline and noradrenaline inside the body, and this might lead to flushing of the skin rather than pallor of the skin. And you know very well from your experience that when you face any stressful condition, you may get pallor of the skin, الجلد يكون شاحب, or you may get flushing of the skin, احمرار للجلد والوجه. إذن, generally speaking, stimulation of the sympathetic nervous system will produce pallor of the skin. And next to that, if we look on the eye, there will be firstly what is called as exophthalmosis. Exophthalmos means there is protruding eye forward, and this protrusion is not real in sympathetic stimulation. It occurs due to lid retraction, excessive opening, large opening of the eye, so it appears as if it is exophthalmosis. The other changes that may be seen on the eye is mydriasis. Mydriasis means dilatation of the pupil. This is before stimulation and this is after stimulation. As you see here, the pupil is widely opened. Why does this happen? During stress, you should be alert and you should be aware of all the things that occur around you. So there will be wide opening of the eye in order to produce a fast and rapid response for the stressful condition. Other conditions that may appear on the body is tremor of the finger and increase in the muscle tone. This is due to overstimulation of the sympathetic nervous system that will produce an increase in the excitability of the nervous system and produce such clinical condition. Other condition, it may lead to erection of the hair. This symptom or sign will appear mainly in animal rather than human being, although in human being it also produces erection of the hair, and this occurs due to contraction of the erector pili muscle that produce erection of the hair, but it is more prominent in lower animals. In addition to the external changes that occur on the body, there will be internal changes. These internal changes are produced to prepare the body for increase in the amount of energy and increase in the amount of oxygen for the different organ of the body, especially the vital organ, in order to face the stressful condition. In order to increase in the oxygen supply to the body, there will be an increase in the respiratory rate and depth of the respiration. So there will be an increase in the amount of oxygen that pass into the body, to the blood, and there will be also an increase in washout of CO2. This CO2 should be distributed in the body so that there will be an increase in the heart rate, an increase in the force of contraction, which is called as inotropic effect, and this will produce an increase in the cardiac output. The increase in the cardiac output will produce an increase in the blood flow to the organ of the body, especially the vital organ. Other conditions, there will be increase in the blood pressure, and you know that the flow of blood occurs due to the delta P, which is the variation in the pressure. The increase in the pressure will produce an increase in blood flow to the different organ. This increase in blood pressure is mainly occur in the systolic pressure rather than diastolic pressure, because the systolic pressure is mainly affected by increase in the heart rate and force of contraction, and there is no much increase in the diastolic pressure because there will be vasodilation in the skeletal muscle, and this will produce decrease in the diastolic pressure. The other thing that there will be decrease in the activity in non-vital organ, like for example GI tract. During stress, we do not need the GI tract, so that there will be decrease in the contractility of the gastrointestinal system and decrease in the absorption of gastrointestinal system. And this decrease in the activity, decrease in the motility, and decrease in the absorption, it might lead to production of diarrhea, frequent bowel motion. And this diarrhea occur as an osmotic effect because the decrease in the motility and decrease in the absorption will produce accumulation of the food inside the GI tract, and this will produce osmotic effect that pull water from the wall of the GI tract, and it may lead to diarrhea. The other condition that will occur inside the body is increased glucose, as we said, to increase energy. This increase in the glucose level mainly occur by movement of the glycogen from the liver and production of glyconeogenesis in order to increase in the amount of the glucose and increase in the energy inside the body. And another condition that may occur during stressful condition is the effect on the adrenal medulla. We said that the adrenal medulla is regarded as a part of the sympathetic nervous system because the adrenal medulla can secrete adrenaline and noradrenaline. And adrenaline and noradrenaline have a similar effect like that of the sympathetic nervous system stimulation because they are representing the same neurotransmitter. So that once there is stimulation of the sympathetic nervous system, especially in emergency state, especially in severe stress, there will be a release of adrenaline and noradrenaline into the blood, and this will produce widespread action of the sympathetic nervous system all over the body, and it may prolong for a longer period, not like that of the sympathetic nervous system. This prolonged stimulation and diffuse stimulation will produce exhaustion and tiredness of the body in severe stress. And this I am sure that you experience this condition. If you face a very stressful condition for a longer period, which will produce palpitation, produce an increase in respiratory rate, increase in the tension of the muscle, tremor. After a while, you will feel that you get exhausted, you get tiredness due to excessive stimulation of the sympathetic nervous system through the adrenal medulla. We talk about the overstimulation of the sympathetic nervous system. If we do removal of the sympathetic system, the removal of the sympathetic nervous system can occur by two mechanisms, either by pharmacological block of the sympathetic nervous system when we give alpha and beta blocker, so we remove the function of the sympathetic nervous system because it do its effect through the receptor, through the neurotransmitter which act on receptor. Or we can do instead a surgical operation that will cause sectioning of all the sympathetic supply to the body. In such condition, by removal of the sympathetic nervous system, the subject will not die. Why does not die? Because the internal organ, all the organ of the body have innate property of function, and the function of the sympathetic nervous system is just to regulate, to increase or decrease. So such subject will not die, but instead he will be extremely vulnerable or sensitive to any changes in the environment, whether it is inside internal environment or external environment of the body. For example, if the subject got removal of the sympathetic nervous system, if there is changes in the environmental temperature or body temperature, if there is changes in the blood like minor bleeding, if there is decrease in CO2 or decrease in oxygen and increase in CO2, if there is decrease in blood glucose level, the subject cannot face this stressful condition and he will die from these minor changes. For example, the increase in the temperature normally produce sweating to correct the body temperature. If there is no sympathetic stimulation, no sympathetic nervous system, the temperature will continue increase and it may lead to death of the subject. Minor bleeding, usually it will induce vasoconstriction. If the patient does not have sympathetic nervous system, so there will be no vasoconstriction and bleeding will continue producing death. If the subject got decrease in the oxygen and increase CO2, there will be sympathetic stimulation that will increase the respiratory rate. If he does not have sympathetic nervous system, there will be death from hypoxia and hypercapnia. If there is decrease in glucose level, this will produce stimulation of the body to get increase by glyconeogenesis or glycogenolysis, and this will improve the condition. If the subject does not have sympathetic, he will die from the decrease in glucose hypoglycemia. Accordingly, sympathetic nervous system will protect the body from any stressful condition, but it will not produce death. He will be unable to face any change stressful condition. These sympathetic fiber, which produce the function of the sympathetic nervous system, are of three types. Either nerve fiber, which are silent during rest, but they are acting reflexly, like for example, the fiber that increase the heart rate and blood pressure. Normally, during rest, these nerve fiber does not produce stimulus. But if there is decrease in blood pressure, this decrease in blood pressure will produce stimulation of a specific receptor اللي هي baroreceptor present at the carotid sinus at the big blood vessel. The decrease in blood pressure at these big blood vessels will stimulate the baroreceptor that stimulates the sympathetic fiber and produce increase in the heart rate, and there will be vasoconstriction. The increase in the heart rate and the vasoconstriction will produce increase in the cardiac output and blood pressure and correct the condition. Then it will return back to resting state and it will be inactive. The second nerve fiber is the continuously active nerve fiber. We said in the previous lecture that the heart have its basal rhythm, basal rate, which is about 60. When we have sympathetic stimulation, it will increase to 100. When we stimulate the parasympathetic and the sympathetic, it will be 70. So that normally the heart rate is 70. Why? Because there is continuous impulse from the sympathetic nervous system that will shift the rate up to 70. So some fiber which is going to the heart have a continuous discharge that produce regular tone of the heart, regular pattern of the heart, regular heart rate. The third type of nerve fiber, the fiber that are stimulated only during emergency, like the fiber to the adrenal gland. We said a moment ago that in severe stress there will be stimulation of the nerve fiber that go to the adrenal gland in order to release adrenaline and noradrenaline into the blood to produce a diffused and prolonged effect. So during rest they are inactive, they are stimulated only in severe stress or in emergency. So that we have three types: reflexly acting, continuous acting, and fiber that are stimulated on severe stress. Now we come to the other division of the autonomic nervous system, the parasympathetic nervous system. This system can be studied simply by stimulation of the specific nerve fiber to the specific organ of the body. Why does this happen? Not like that of the sympathetic nervous system. Because we said that the anatomical arrangement of the parasympathetic nervous system differ from that of the sympathetic. Most of the ganglia which are related to the parasympathetic nervous system are peripheral ganglia, so that they have long preganglionic and short postganglionic localized to the effector organ. So we can stimulate each organ separately and we'll get a response of that organ separately. So that we can study the effect of the parasympathetic for each organ. The nerve fiber which go to the lacrimal gland, on stimulation of the parasympathetic, it will produce lacrimation. The fiber that go to the eye, to the ciliary muscle, on stimulation, it will produce contraction of the pupil, and instead of mydriasis that occur on sympathetic stimulation, we will get meiosis, decrease in the pupil size, and this occurs due to contraction of the ciliary muscle. If we do stimulation of the salivary gland, this will produce salivation, and if we remove the parasympathetic, it will get dryness of the mouth. These two symptoms can be easily seen when we are using anticholinergic drug, like for example, atropine, buscopan, or any anticholinergic drug that block the parasympathetic nervous system. So the side effect of atropine, there will be dryness of the mouth, there will be constriction of the pupil that might lead to blurred vision, and we can judge any side effect of anticholinergic drug from this response of the parasympathetic stimulation. Now we come to other organ of the body, like for example the GI tract. You know that the GI tract, on stimulation of the parasympathetic nervous system, it will produce an increase in the motility of the GI tract and increase in the secretion of the GI tract. If we take each part of the GI tract separately, the fiber that go to the esophagus is important for secondary peristalsis, increase in the peristalsis, secondary peristalsis of the esophagus. So it will help in pushing the bolus of the food downward into the stomach. For the fiber of the stomach, the parasympathetic stimulation will produce an increase in gastric juice and hydrochloric acid secretion, so that if patient got peptic ulceration due to high hydrochloric acid secretion, we do sectioning of the fiber to the sympathetic to the stomach, and this will produce decrease in secretion of hydrochloric acid. Fiber to the pancreas, gallbladder, and the intestine. Parasympathetic stimulation will produce in secretion and motility, increase in the gallbladder secretion, increase in the pancreatic secretion, and increase in the secretion of the intestine, as well as the motility of these organs. Fiber to the rectum, and this is very important for the process of defecation or evacuation of the sigmoid and colon. Another fiber go to the lung, and this is responsible for a smooth muscle contraction. This will produce contraction of the smooth muscle of big airway, and this will produce a state like that of asthma, bronchospasm like asthma. If we remove the parasympathetic nerve fiber to the bronchial muscle, it will produce dilatation and improvement of the attack. And this is very important in certain clinical condition, which is called as exercise-induced asthma. In such conditions, some patients during exercise, they may get spasm of the bronchial muscle and produce asthma-like state. Such patient can be improved by giving atropine that block the parasympathetic nervous system to the respiratory system. The other condition is fiber which go to the heart. These fiber, generally speaking, the parasympathetic supply is mainly for the SA node and AV node, that is to say, the conductive system of the heart. So, the stimulation of the parasympathetic will produce decrease in the activity of SA node, so there will be decrease in the heart rate, decrease in the activity of the AV node, so there will be decrease in the transmission of impulse from the atria to the ventricle, and that what call as heart block and severe stimulation of the parasympathetic nervous system. So, on severe stimulation of the parasympathetic nervous system to the heart, it does not produce decrease in the inotropic effect or decrease in the contraction of the cardiac muscle, but it will produce decrease in the heart rate and decrease in the excitability of the muscle, and it may lead to different stages of heart block: first degree, second degree, or third degree heart block. Next, the fiber to the urinary bladder, and the stimulation of these fiber, it will produce urination like that of the defecation. So that urination and defecation, it is the function of the parasympathetic nervous system. The other fiber to the sexual organ. On stimulation of the parasympathetic nervous system to the sexual organ, it will produce penile erection. And this occurs due to vasodilation in the corpora cavernosa that will lead to filling of the penile cavernosa sinuses with blood, and this will produce erection. On the other hand, ejaculation is the function of the sympathetic nervous system, not like that of the penile erection. Accordingly, we can compare the function of the parasympathetic nervous system with that of the sympathetic nervous system on each organ. Although sympathetic stimulation occurs diffusely all over the body, the parasympathetic occurs by localized stimulation of each organ of the body. The sympathetic stimulation, as we said in the beginning of the lecture, on the eye, it will produce dilatation of the pupil to increase the alertness of the subject, while the parasympathetic nervous system will produce constriction of the pupil. On the salivary gland, the sympathetic nervous system will produce inhibition of the salivation. Although it will produce increase in the contraction of the smooth muscle and the release of thick viscous type of secretion, but it does not produce watery salivation like that of the parasympathetic nervous stimulation. Next, on the heart, the sympathetic nervous system will produce an increase in the heart rate, increase in the cardiac output, increase in the blood flow, while the parasympathetic nervous system will produce decrease in the heart rate and decrease in the excitability. On the lung, the sympathetic nervous system, as we said, produces dilatation of the smooth muscle in the bronchus, while that of the parasympathetic will produce constriction. And this is clinically is important because in certain conditions, in asthmatic state and bronchiolitis, which are characterized by contraction of the smooth muscle, we can give adrenaline or noradrenaline to the patient, and this will produce dilatation of the bronchus and relief of the asthmatic attack or bronchospasm. On the heart, we said that the parasympathetic stimulation will produce an increase in the secretion of hydrochloric acid, increase in the contraction, while the sympathetic stimulation will produce inhibition of the secretion and inhibition of the digestion. On the liver, stimulation of the parasympathetic will produce release of the bile, as we said a moment ago, while sympathetic stimulation will produce an increase in the glucose release from the liver. And on the intestine, the parasympathetic will produce increase in the motility of the small intestine and produce defecation, while the sympathetic stimulation will produce decrease in the motility. This is also clinically important. In certain surgical operation, if the surgeon manipulates the small intestine for a long period, يعني touch the small intestine for a long period, it might lead to overstimulation of the sympathetic nervous system and paralysis of the intestine will occur, and this may lead to death due to osmotic diarrhea and electrolyte disturbance that occur as a result of overstimulation of the sympathetic nervous system. On the bladder, the parasympathetic is responsible for urination, while the sympathetic nervous system will produce decrease in the urination. Now we come to other subject in relation to the autonomic nervous system. This is the higher center. We said in the first lecture that there are higher centers which include the supracortex, hypothalamus, and brainstem medulla and midbrain. All these structures are present in the central nervous system within the skull and the spinal cord. Each one of them have a specific function for regulation of the autonomic nervous system. As you see here, we have the supracortex, we have the hypothalamus, we have the brainstem. These are representing the higher center of the autonomic nervous system. The most important of which is the hypothalamus. Less than that, the other part, like that of the cerebellum, which is mainly related to emotional changes of the body. And then we have the centers, the vital center and the reflex center, and the medulla oblongata, and the brainstem and midbrain. The first higher center is the supracortex. There are certain area or certain cells within the supracortex that can send impulses through the brainstem, either directly or indirectly through the center of the brainstem or hypothalamus, and these impulses will send to the autonomic nervous system to regulate the different organ of the body according to emotional factor. For example, if there is a stressful condition, as for example, I ask you to do an exam at this moment or tomorrow, you will get a stressful condition due to excitation of the cerebral cortex. This orientation about the stressful condition of the exam will send impulses to the midbrain and the hypothalamus, and this will produce an increase in the heart rate, palpitation, increase in blood pressure, and sympathetic stimulation that occur due to orientation through the cerebral cortex. If the subject does not have cerebral cortex, he will not understand that there will be an exam today or tomorrow, so that there will be no changes in the body according to this emotional factor. For example, another example, if you are feeling shame, also this through the cerebral cortex, it will produce changes in the activity of the body and the organ of the body according to the cerebral cortex stimulation, and then through the hypothalamus and brainstem, it will change the body activity. Even the first higher center is present in the cerebral cortex, but we should know that there is no specific area in the cerebral cortex that is related to the stimulation or regulation of the autonomic nervous system. The other side or other higher center is the hypothalamus, and this is regarded as the main hypothalamic center that regulates the autonomic nervous system. The hypothalamus is present within the brain and near the third ventricle, adjacent to the third ventricle, and this is formed of many nuclei, as you see here in this diagram. We have the preoptic, the supraoptic nuclei, the mammillary body or mammillary area, and also we have the paraventricular area and tuberal area. Each one of them have a specific control on the autonomic nervous system. This hypothalamus represents the main autonomic center in the body, and it regulates the different function of the body according to two pathways, either direct effect or indirect effect. The direct effect through the nerve fiber, we call it as neural control of the hypothalamus. And this neural control occurs because in the centers which are present in the hypothalamus, we have a sleeping center, we have hunger center, thirst center, many centers. Each one of them regulates certain function of the body according to the sympathetic or parasympathetic stimulation. For example, the hunger center will stimulate the GI tract, stimulate the appetite, and this will change the activity of the GI tract. The third center will affect the intake of water and affect the process of urination, decrease in the urination, and these will represent the main control through direct effect and neural factor. Then we have the indirect factor. The hypothalamus is connected to the pituitary gland through the pituitary stalk, and the pituitary gland secretes releasing hormone that control all the gland of the body. The pituitary gland is called as the master gland that control all the hormone or all the gland inside the body, so it will control all the body activity. Accordingly, the hypothalamus can control all the body function through direct control اللي هو neural control or indirect control through the hormonal control. As you see here, this is the hypothalamus, and this hypothalamus can send impulses through nerve fiber, and these nerve fiber will send the impulses either to the brain, pons, and midbrain, medulla oblongata, or send it to the supracortex, then downward into the midbrain and hypothalamus and the brainstem, and these will control body activity. Or the hypothalamus can influence the function of the pituitary gland through the stalk, and this will produce increase or decrease in the releasing factor and decrease and increase in the stimulation of the different area of the pituitary gland, so control the function of the other gland of the body. The direct effect that we call it as neural pathway. The impulses from the hypothalamus will be sent either to the spinal cord directly, or to the brainstem, or through the supracortex. In this area of the hypothalamus, there are certain centers, as we said a moment ago. We have appetite center, we have thirst center, sleep center, center for control of temperature, center for emotional regulation, center of regulation of sexual activity, and these will control the different organ of the body. One of these centers is the appetite center. If we come in more detail of the appetite center, we have it is formed of two sides: appetite center and satiety center. الابيتايت center يشمل جزئين: الابيتايت center and satiety center. The appetite center stimulation will produce increased intake of food. Opposite to that, the stimulation of the satiety center will produce decrease in the intake of the food. How can the body regulate this center? If there is decrease in the blood sugar, there will be stimulation of the appetite center to increase in the intake of food, so increase in the blood glucose. If there is if there is an increase in the blood sugar, then there will be stimulation of the satiety center to decrease intake of food and decrease the blood sugar. Accordingly, if there is defect in the appetite center or satiety center, it will produce clinical changes or clinical diseases or clinical problems. Like, for example, obesity occurs due to overstimulation in the appetite center, and anorexia nervosa is due to overstimulation of the satiety center. Why does this happen? Because either there is decrease in the sensitivity of these receptors to glucose levels, or due to the fact that there are another stimulus from the supracortex or from other side of the body that stimulate the appetite center. For example, there are certain women who have increase in the appetite when there is stress or there is depression, so that they will get obesity due to depression and not due to decrease in the blood glucose. Opposite to that, we have satiety center defect, which might lead to anorexia. This is either due to direct defect in the center not responding to the blood sugar level, or it might be due to psychological problem. There are some women who feel shame from obesity, so that there will be overstimulation from the supracortex to the satiety center to produce stimulation, overstimulation of the satiety center, so there will be decrease in the intake of food and sometimes associated with nausea and vomiting, so there will be starvation state that may lead even to changes in the electrolyte of the body, and there will be cachexia due to decrease in the intake of food. Another center that is present in the hypothalamus is the sleeping center. And this sleeping center is partly related to the hypothalamus through the nuclei, raphe nuclei and local cellular that regulate the sleep and the sleep pattern. These two nuclei are acting on certain area in the midbrain, that is the reticular activating system. This reticular activating system is formed of nerve fiber and nerve fiber and nerve cell. How can this reticular activating system do its action? It represents a pathway, a gate, بوابة, that let the impulses to go from the sensory nervous system to the supracortex to get a wakefulness. If there is a block of this pathway or block of this gate, then the sensory impulse cannot reach the supracortex, so that there will be sleep. The raphe nuclei and local cellulars will influence the function of the reticular system, so we will get wakefulness and sleep according to this control. The neurotransmitter from these nuclei that influence the reticular activating system and influence the supracortex are mainly noradrenaline, and serotonin. Generally speaking, noradrenaline will produce excitation and serotonin will produce inhibition, so this will produce sleep and that will produce change in the sleep pattern or change in the alert. The other pathway that occurs from the hypothalamus to control the body activity is the indirect pathway. As we said, this is called as the humoral or hormonal factor. And this occurs because the hypothalamus secrete certain substances which are called as releasing factor. These releasing factor from the hypothalamus will descend down to the anterior and posterior pituitary. The anterior pituitary is influenced by the releasing factor, and the posterior pituitary is really part of the hypothalamus. It is representing the nerve ending for certain nuclei of the hypothalamus. If we do stimulation of the hypothalamus, this will produce release of releasing factor. This release of releasing factor will act on certain cell in the pituitary, anterior pituitary, like that cell which is secrete growth hormone to increase secretion of growth hormone. Also, there is thyroid stimulating hormone releasing hormone that regulate the secretion of thyroid stimulating hormone. We have releasing factor for adenocorticotrophic hormone that regulate the secretion of adenocorticotrophic hormone. We have releasing factor from the hypothalamus which will affect the follicular stimulating hormone and luteinizing hormone and prolactin. Accordingly, this releasing factor which is secreted from the hypothalamus will influence the anterior pituitary for regulation of these hormones: growth hormone, thyroid stimulating hormone, adenocorticotrophic hormone, follicular stimulating hormone, and luteinizing hormone. If there is stimulation of the hypothalamus during puberty, there should be an increase in the growth, and this releasing factor will affect the growth hormone, increase in the growth hormone, increase in the metabolism, and increase in protein synthesis and growth. Hypothalamus stimulation will produce a releasing hormone for the thyroid. We call it thyroid stimulating hormone releasing hormone that stimulates the secretion of thyroid stimulating hormone. Thyroid stimulating hormone from the anterior pituitary will go to the thyroid to produce secretion of T3 and T4, and that will produce an increase in metabolism and increase activity of the body. Also, releasing hormone for the adenocorticotrophic hormone releasing hormone. This will produce an increase in adenocorticotrophic hormone. This adenocorticotrophic hormone will act on the suprarenal cortex, and this will produce an increase in the cortisol and change in the body. Also, we have releasing factor for follicular stimulating hormone and luteinizing hormone, and these hormones are responsible for regulation of the genetics and genitourinary system, genital system, and these will produce an increase in the formation of the sperm, an increase in the secretion of the sex hormone, an increase in the ovulation and formation of the ova, an increase in the secretion of estrogen and progesterone in female. So these will regulate the activity of the genital system and so on. Even the hypothalamus can control all the activity of the body through the anterior pituitary hormone by regulation of the secretion of the anterior pituitary hormone that control the other gland of the body. Next to that, we have the posterior pituitary gland. The posterior pituitary gland really it represents a nerve ending of certain area of the hypothalamus. For example, the posterior pituitary gland secrete oxytocin. The oxytocin really is synthesized in the supraoptic nuclei, which is the nuclei in the hypothalamus, and the paraventricular nuclei, which is present in the hypothalamus. When we stimulate the hypothalamus, there will be secretion of oxytocin. Oxytocin is hormone which is essential for the process of lactation, stimulation of release of milk from the breast of the mother. It is also important for the process of delivery, birth of the child. So when there is a stimulation of the oxytocin, we will get regulation of the secretion of the milk and regulation of the delivery of the pregnant mother. Next to have we have the antidiuretic hormone. It is also released from nuclei of the hypothalamus. This antidiuretic hormone will regulate the process of urine concentration and dilution. We have certain diseases that may affect this part of the hypothalamus. For example, diabetes insipidus. You should not be confused between diabetes insipidus and diabetes mellitus. Diabetes mellitus is due to decrease in insulin, but diabetes insipidus is due to congenital disease that is associated with decrease in the antidiuretic hormone. If there is decrease in the antidiuretic hormone from its name, antidiuretic hormone, مضاد للurination. Antidiuretic hormone, if it is decreased, so there will be an increase in urination that we call it polyuria لأنه ما في antidiuretic hormone. And also, if there is polyuria, decrease in amount of water inside the body, there will be stimulation of the third center, and this will produce polydipsia. So there will be an increase in the intake of water. So in diabetes insipidus, there will be excessive urination and excessive intake of water. In addition to that, there will be diluted urine. It is of low specific gravity. If we examine the urine, the specific gravity will be very low. It is about 1010, usually 1020, and this is due to decrease in the concentration of urine by the antidiuretic hormone, which is usually a produce reabsorption of water by reabsorption of the different. Next, the third center of the regulation of the autonomic nervous system is the brainstem and medulla oblongata and midbrain. At this area of the upper part of the spinal cord, we have two centers. One is called the vital center and the other is called the reflex center. The vital center from its name, vital center, they are regulating the vital organ like respiratory system, cardiovascular system, the blood vessel. These vital centers will regulate the respiratory system, cardiovascular system, vasomotor system, either by sending impulses to the chief preganglionic nerve fiber in the spinal cord or through the cranial nerve through the cerebral cortex and hypothalamus. إما عن طريق الchief preganglionic nerve in the spinal cord or cranial nerve or through the cerebral cortex and hypothalamus. This will produce regulation of respiration all the time. It does not occur reflexly. It is always control the respiration because it is continuously have a certain rhythm and certain blood pressure, certain heart rate, vasomotor, certain blood pressure in the blood vessel due to the constriction of the smooth muscle of the blood vessel. Accordingly, these vital centers control the vital organ continuously. If there is damage of these vital centers, it will lead to death, as it is happen in certain type of CVA, cerebrovascular accident, bleeding or ischemia in the brainstem, medulla oblongata, and midbrain, or due to herniation of this area and compression of this area through foramen magnum, and this will produce immediate death due to damage in the vital center. We have another group of nuclei which are called reflex center. Inside this area, we have certain collection of nerve cells acting as a reflex center, like swallowing center, vomiting center, coughing center, sneezing center, and these are acting reflexly. They are not continuously active like that of the vital center. They act reflexly. For example, during swallowing, there will be inhibition of respiration by reflex activity. During vomiting, there will be dilatation of the cardiac opening of the esophagus or the stomach, and there will be evacuation of food. During this process, also there will be a process of salivation, so that these reflexes will control the different organ of the body in certain condition. Like for example, if there is toxicity with certain substance which is eaten accidentally by the subject, there will be vomiting. And during vomiting, there will be excessive salivation, there will be sweating, there will be palpitation, there will be many changes that occur in the body through the stimulation of the reflex center. One of the important center is the tractus solitarius, and this control the nuclei of the cranial nerve in order to regulate the reflex centers and regulate all the body activity in certain conditions. Thank you very much.